Hello everyone. So let's start with the topic of muscles of back of forearm. So when we are talking about the muscles of back of forearm, it is categorized as superficial group of muscle and that of the deep group of muscle. So total we have got 12 muscle in this category. Firstly, let's start discussion of the superficial group of the muscles. These are all extensor group of muscle and most of all the extensor group of muscles are getting origin from common extensor origin, that is the lateral epicondyle. So basically, if I am talking about the muscles of back of forearm superficial group, in this category we have got 7 muscles: brachioradialis, extensor carpi radialis longus and extensor carpi radialis longus and brevis. So together we have got 3: extensor digitorum, the fourth one, extensor digiti minimi, extensor carpi ulnaris and anconius. So we have got together 7 muscle in this category. Okay, so we have got 7 superficial group of muscle which has been highlighted in this diagram. Most of the muscles originates from the common extensor origin, that is lateral epicondyle of humerus. I would like to show you few images of these muscles and also like to show you an individual diagram showing the attachment of these muscles and action and the nerve supply of these muscles. So again, let's see another diagram. In this diagram, you can appreciate the superficial layer of the posterior compartment muscles of the forearm, where you can appreciate here, the brachioradialis has been shown, which is this one is the brachioradialis muscle. Okay, if you want, I can slightly enlarge this so that you can have a better idea. So yes, we have got here the brachioradialis muscle. We have got extensor carpi radialis longus and that of extensor carpi radialis brevis. Here, brachioradialis and extensor carpi radialis longus is originating from the lateral supracondylar ridge of the humerus bone. ECRB, extensor digitorum and that of extensor carpi ulnaris and that of extensor digiti minimi. Okay, this is the extensor digiti minimi. These are the muscles which are having the origin from the lateral epicondyle of the humerus bone, and we have got another small muscle, that is anconius. So actually this anconius muscle is a small muscle which is arising from the posterior aspect of the lateral epicondyle and inserts onto the upper 1/4 of the ulnar bone. So we will discuss one by one these muscles. So it is highlighted in this diagram all the 7 superficial group of the muscle. Now let's also show you the diagram of showing the back muscle which is lying in the deeper aspect. So muscles of the back in the deeper aspect. So when I am talking about the deeper aspect of the muscle, we have got 5 muscle in this category. Here we have got the supinator muscle, important supinator of the forearm. We have got abductor pollicis longus. We have got 2 extensor pollicis longus and also extensor pollicis brevis. These are for the thumb extension, and we have got 1 for the index finger, that is extensor indicis. So together we have got 5 muscle in this category. So together 7 plus 5 we have got 12 muscles. So each of the muscle we will discuss in detail. Again, I would like to show you one more diagram where you can appreciate clearly the supinator muscle, the abductor pollicis longus, the extensor pollicis brevis and that of extensor pollicis longus, and also extensor indicis muscle for the index finger. Few cadaveric images in which you can see the muscles of the back. So here, in this diagram you can appreciate the muscles. You can see the brachioradialis muscle, and you can also appreciate in this diagram that brachioradialis muscle tendon is originating from the lateral supracondylar humerus bone. Then we have got adjoining close to it, we have got the extensor carpi radialis longus, and just close to it we have got ECRB, extensor carpi radialis brevis. Also in this diagram, the deeper muscles, this is abductor pollicis longus can be seen, and also we can see the extensor pollicis brevis and other muscle which is of the superficial group, the small muscle of the posterior aspect of the elbow joint. A for anconius muscle, extensor carpi ulnaris which is the medial one, and we have got this digitorum for the extensor digitorum for the 4 fingers except the thumb. So in extensor group of muscle, actually we have got extensor for the index finger, we have got extensor digitorum, and we have got extensors of the thumb, extensor pollicis longus and extensor pollicis brevis. We have got also abductor pollicis longus for the thumb. So let's talk individual muscle. Before that, I would like to show you few more diagram where you can appreciate the muscles. So we can see here brachioradialis, ECRL and ECRB are Actually, when we are talking of these three muscles, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, this is more on the posterolateral aspect. This is more on the posterolateral aspect. Extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, these are and anconeus, these are the muscles on the posterior aspect of the back of the forearm. But if we talk about this three muscle, brachioradialis, ECRL and ECRB, they are more posterolaterally. Now, I would like to appreciate each of the muscle with this diagram and help you to understand the attachment. So, here we can see the brachioradialis muscle. So, when we are talking about the brachioradialis muscle, you can clearly appreciate in this diagram that brachioradialis muscle is originating from the humerus bone. To be more specific, you can appreciate that it is originating from the upper 2/3 part of the lateral supracondylar ridge of humerus bone. Upper 2/3 of the lateral supracondylar ridge of humerus bone. Now, if you see the insertion point, so see this tendon, you can appreciate this tendon and you can appreciate that the tendon of the brachioradialis muscle is inserting on which bone? That is the radius bone. At which level? So, insertion of brachioradialis muscle is just distal to, is just on the distal aspect of, so it is on the distal aspect of or the lower part of radius bone, just above the stelloid process of the radius bone, just above the stelloid process of the radius bone. This is about the origin, insertion of the brachioradialis muscle. Other than that, I would also like to show you this diagram where you can appreciate the brachioradialis muscle. The tendon of the brachioradialis muscle is lying more laterally, originating from the lateral supracondylar ridge. And what about its action? So, this is one of the extensor group of muscle which is also causing flexion of forearm. So, it is also involved in flexion action. It is also, it's a muscle which is basically in the extensor group, but it is also an important muscle which is involved in flexion action. It is also causing flexion of the elbow joint. And other than that, so flexion action is done. And if I talk about the other action of brachioradialis muscle, so this is one muscle which is also causing the action, like it's active in the mid-prone position. So, it supinates the forearm from the mid-prone position and it pronates the forearm to the mid-prone position. So, these are the two actions of brachioradialis muscle. So, other than that, it is also important that if I talk about the brachioradialis muscle, this is causing the flexion, it is causing the flexion of the elbow joint, and other than that, it is involved in pronation and supination of forearm to the level of mid-prone position. That means if this is the mid-prone position, it supinates from the mid-prone position and it's pronate to the mid-prone position. This is the action. And also the flexure of the elbow joint. Other than that, what is the nerve supply? So, actually all the muscle, if I talk about all the extensor group of muscles are getting innervation from radial nerve. But brachioradialis and that of extensor carpi radialis longus is directly getting innervation from radial nerve. So, here please note down brachioradialis and extensor carpi radialis longus is directly getting innervation from radial nerve. Other than that, all other muscles are getting innervation from deep branch of radial nerve, that is posterior interosseous nerve. Now, let us see the extensor carpi radialis longus muscle. So, just below brachioradialis muscle, if you will see this diagram, and let me use green color for this brachioradialis. So, you can see on the lateral aspect, just below brachioradialis muscle, if this is BR for brachioradialis muscle, just below it we have got ECRL. So, its origin is also from the lateral supracondylar ridge of, it is also originating from lateral supracondylar ridge of humerus bone, that is the lower 1/3 part of the lower 1/3 part of the supracondylar ridge. And if I talk about the insertion, it is inserting into the metacarpal bone, that is the second metacarpal bone. I would like to show you this diagram. Okay, see here. So, you can see here, this is extensor carpi radialis longus muscle originating from the supracondylar ridge of the humerus bone. Origin is shown on the lower part of the supracondylar ridge of humerus bone, and as I told you, its insertion is onto the base of second metacarpal bone. It is inserting. Can you see here? This is the metacarpal bone and this is the second metacarpal bone. So it is inserting at the base of second metacarpal bone from the dorsal aspect. Now, so it's also important to know the extensor carpi radialis longus nerve supply and action. So yes, if I talk about its nerve supply and action, so this extensor carpi radialis longus, as we have already talked, it is getting innervation from directly from radial nerve, and its action